So after you've clipped your wound site, you're going to want to flush out as much debris as possible, as much sterile saline as you can run through the area, because that's what's going to flush this debris out. So we've got a sterile saline. Okay. Now initially we flushed considerably more fluid through this fresh wound. Today it looks pretty good, so we're not going to worry about doing as much. But when in doubt, it's better to flush more over it than little. Okay. And stop. There we go. The nice thing about this solution here that I have is when I squeeze it, the fluid's coming out at a good clip. So if you think about it, if there's bacteria on the surface and I'm hitting it with this, it bounces that bacteria up and off.
What's the fluid, Carrie?
This is just an antiseptic, and this one also has lidocaine in it, which is a little bit of a numbing agent, which I like. What we're doing is we're actually using the squeeze bottle here to our benefit to bounce any debris or bacteria out of that wound. I know, baby girl, you're very brave. Word of advice, restraint is key when dealing with any wound, because it does hurt and they don't mean to bite you, but they will. So always be safe. Another thing you can do for cleaning is to get maybe a little bit of Novel Sand or chlorhexidine diluted in water and have it in a spray bottle, and the spraying action too will also bounce some of that bacteria and debris out of there. Okay, so this is just how to do a basic wet to dry bandage. You're going to take your 2x2 gauze squares. I have at least 2 to 3 thick on each pile. This is a two-sided wound. And again, sterile saline, just enough to wet this down. Wet to dry bandage is great when you've got a contaminated wound and you want to get out debris. Okay, we can stop with the saline. Good. And what happens is this is going to keep the tissue moist to start. And as the bandage dries down, it's going to grab a hold of dead tissue and debris so that when you pull the bandage off, get a good hold on that leg, that debris is going to come with it. Stop for a second. When you roll gauze out, you always want to start at the bottom of the foot with wrapping and then wrap up. You want to go loosely. It's kind of a balancing act. You don't want it so loose that it falls off, but you don't want it so tight that you cause swelling on the paw.
Laser.
Okay. The next layer would then be vet wrap.